Xoli, good evening to yourself, and also let me take this opportunity to greet the Newzroom Afrika viewers. Xoli, the how much change is immediate in terms of projects that we're implementing in our facilities, our hospitals, and the clinics, and across the province. There are projects that are actively ongoing as we speak. For an example, the Helen Joseph Hospital that would have been in the news over the past few weeks. We have just completed a newly refurbished, expanded emergency accident and emergency department that also includes a mental health ward. We take, for an example, as we speak, the Xolisani Hospital. We have a program that we call recapitalization, where we change all of this equipment that supports our theaters and so forth, the chillers and all of that. That project is ongoing in Xolisani Baragwana as we speak. We also have concluded, Mr. Mugambi, the 30-bed mental ward at the Bethakloa hospital in the East Rand. There are quite a number of other projects that are actively. Far East, you have a project that is ongoing, including Tembisa. We have just finished also refurbishing a accident and emergency ward in that particular hospital. There's also a project that we are refurbishing and changing the entire HVAC system. And HVAC system is the aircon that enables your facility to keep the proper temperature so that you're able to proceed with your surgicals in those particular. So those are the projects that are actively ongoing.
Okay. A person listening will say, this sounds very good and it sounds promising that you are saying, quote unquote, these changes are immediate. What's taken so long?
Maybe for the benefit of the viewers, the Department of Health previously, the maintenance work was undertaken by our sister department, and we were just providing the funding. But however, I think the leadership, after the realization of the backlog and the challenges that we're facing, took a decision, a correct decision in my view, to say an infrastructure department within the department must be beefed up to be able to roll out. As we speak now, the majority of the maintenance work that is rolled out across the province of Gauteng, we are doing that internally as the Department of Health. We have capacitated the unit, myself as the DDG, the chief directors and the directors, and also in our facilities. We have put quite the required skills that are there to be able to monitor this kind of work. And what we have also done, is that, yes, we've got over 400 facilities across the province, but what we're proud of ourselves is that in each of all of those facilities, we've got maintenance plans that we have put in place. Yes, of course, we might not have all the money required to be able to undertake all that work at the same time. And therefore, we do the prioritization based on the maintenance plans for institutions that would have put in place. So, yes, it has taken time, but we are going ahead vigorously. And even within the department, as we speak in the current financial year, we are looking at areas where we can redirect budget into maintenance. Going into Helen Joseph again, the word that the gentleman was, we went there immediately after Sunday and looked at it. Yes, the infrastructure is old because the hospital itself is old, but it's functional. But what we have then taken a decision is that let's overhaul that ward, including some of the other wards in that particular facility.
Well, I was actually going to circle back to Helen Joseph because it all sounds promising. It sounds really good based on what you are saying. But if we look at the state of that ward, what does the rest of the hospital look like? Yes, you can go into that ward after Tom London's expose, but what does the rest of the hospital look like?
As I've indicated, it's quite an old hospital, and we've got the active, even prior to the complaint by the patient, Mr. Tom London, there were projects that we've done. For an example, there are about 12 theaters in that particular hospital. From October last year, we began a project of refurbishing them and revamping them, equipping them. There were 2 that were left, which is 4 and 5, where we had to change the vinyl so that we're able to be compliant. So yes, because of the budget challenges, as I've indicated, we couldn't do everything all at the same time. And unfortunately, Mr. Tom London had to be in one of those wards with some of the challenges, issues around painting and so forth. And indeed, we have acknowledged that yes, the infrastructure there is old, but we have attended it. It was functional and there was clean, which is the most important thing. It was clean in the facility. You could roll out the clinical services, treat patiently, and give them quality healthcare. But we also acknowledge the fact that we had to come and intervene and make sure that where there are areas of concern, we deal with those from an infrastructure point of, which is something that we're doing. There are contractors as we speak on site in that particular facility, not only on that, as I've indicated, also across other facilities that we have in the province.
Sure. Look, I want to quickly talk about staff attitudes, but before I do that, I think the viewers would be keen to know what is the budget for these upgrades, because that's what they are. And as you talk about that budget, I'm thinking of the Chris Hani Baragwanath Hospital. It's a massive hospital. I remember at one point, the former premier of this province, Nomvula Mokonyane, suggesting that it actually is possibly the biggest in the southern tip of Africa, that hospital. So how do you do refurbishments at the same time as receiving patients? Because it is quite busy as well.
Yes, you are correct, Xoli. It's quite difficult, but we, together with the CEO of that facility, quite young, very energetic, and her staff, we do what we call decanting plans, where we have to move patient to be able to refurbish where we need to. But coming to the issue of the budget, you are quite correct. Xolisani is quite huge. And the current allocation that they had in the current financial year, they had just about, for maintenance work, they had about over 60 million rand, which is a drop in the ocean because you consider Xolisani Bara, within that facility, you have over 400 buildings within that facility, which is quite huge. And that is a drop in the ocean. But we are quite happy that we have compiled a business case submitted to Gauteng Provincial Treasury so that we're able to request additional funding to be able to attend to that particular facility. You would recall that also the Premier has made an emphasis to say, let's deal and focus on the Chris Hani Baragwanath. In terms of the overall allocation for maintenance, in the current financial year, we have a budget of about 1.1 billion. But the challenge here, actually, you have 1.1 billion, but you still have to deal with the accruals, meaning the debt from the previous financial year. And in the current debt that we inherited from the previous financial year was around 500 million. So you can see, out of that 1.1 billion, you're only left with 600 million to do maintenance works across more than 400 facilities within the province of Gauteng. Hence, I've indicated that the MSS took a decision to say, let's identify areas where we can identify budgets and redirect those budgets towards the infrastructure upgrading within our facilities.
Yeah. Very briefly on this point, I mean, it is one that a department like yours, which was hugely defrauded during the COVID-19 era, it's only fair that I ask about the seepage. I'm asking about potential opportunities for those who are corrupt. There are going to be tenders all around. I'm looking at that maintenance of 60 million rand per year that is budgeted for Chris Hani Baragwanath. How do you prevent corruption? What safeguards are there?
Look, actually, what we are doing, particularly as an infrastructure within the department, is that and our SCM, our supply chain management, is that all issues around procurement are transparent. And where we are going out on competitive tender processes, which are transparent out there in public and all of that. But it doesn't end there. Because once you have finalized the appointment of those people, you must then make sure that those that are appointed are delivering that work as per what is required and in the right quality. And within the department, there is a department called the risk, which we have finalized the appointment of the new chief risk officer, which amongst one of their chief responsibilities is to make sure that there's value for money, meaning whomever that has been allocated work delivers that work within the specified scope that would have been given. Also, the Gauteng Provincial Treasury, with their internal audit, from time to time, they would seek those reports from us, quarterly in this instance, and also making sure that we account for each and every cent that we have spent. For an example, yesterday and today, we had a session with the Gauteng Provincial Treasury where they were requesting what we call portfolio of evidence for each and every contract that we have awarded as infrastructure and how that money was spent. On top of that, Xoli, we have just concluded a process by the Auditor General of South Africa. Also, they would have identified certain gaps when it comes to SCM, which we're dealing with that together with the Chief Financial Officer of the department.
All right. I want to conclude the conversation, Mr. Galada, with staff attitudes. You can have a beautiful infrastructure inside and outside, but if the people that are attending to patients, if their attitudes are appalling, if their attitudes stink, unfortunately, the experience that the patient walks away with is one that says, if one day I have money, I will never go back to that hospital. What are you doing to improve staff attitudes?
It's quite a critical area within the department, and one of the highlights by the MEC Nkomorale Huku, who has introduced a program that is called the Serve with a Smile. And the intention of that is really to change the attitude of the staff towards the public and the patients that we receive. I mean, the last thing you would want to see as a patient coming into a facility is to come into a facility where there's no warmth, there's no receptiveness, and so on. So that campaign seeks to address all of that. It filters from the doctors, the clinicians, the nurses, and everybody. That's the campaign that there's a team that has been put in place by the MEC to specifically deal with that, the issues of staff attitude. I mean, the MEC has gone further to say, in our facilities, we should behave like in the banks. Because when you come in the bank, a person receiving you will ask you, how are you? How can I help you? And then you are processed thereon. So that's the kind of the Department of Health that we want to do. We've also started a campaign to say, as the Department of Health, based on the programs that we want to put in place, we want to be an employer of choice. People must then, out of their own, want to come to the department. So that program, Serve with a Smile, will go a long way actually in addressing some of the concerns towards the issues of staff attitude.
Gauteng Health Deputy Director General for Infrastructure, Xolisani Galada, thank you very much for your time, sir, this evening.